Healthcare costs can destroy your retirement plan before you even transition to Medicare. According to Fidelity's latest research, the average couple will face $315,000 in healthcare expenses during retirement. Today, we're going to show you how to properly navigate the Medicare system and minimize these costs. Now, we're connecting with David Montgomery.
Plus a 2% administrative fee. For a family, it can be $2,000 to $2,500 per month. COBRA lasts a maximum of 18 months. In some cases, it can extend up to 36 months. The healthcare marketplace operates under the Affordable Care Act. Here, you can receive subsidies based on your income. In 2025, if a couple's income is below $75,000, we can get significant support. But be careful, withdrawals from your retirement accounts are also included in the income calculation. This is where smart retirement planning comes into play. How do you plan your withdrawals during the 50 to 65 age period? This directly affects your health insurance premium. Doing Roth IRA conversions during this period can make sense, because you can keep your taxable income low. Now we're getting to the main topic. Medicare. Your application period begins 3 months before you turn 65. This is very important. If you're late, you pay a penalty. You pay this penalty for life. Medicare has 4 main parts: Part A, Part B, Part C, and Part D. We need to understand each one separately. Part A is hospital insurance, inpatient treatment, hospice care, skilled nursing facility. Part A is free for most people because we paid Medicare tax while working. You must have worked at least 40 quarters, meaning 10 years. If your spouse worked, you're covered too. Part B is doctor insurance, outpatient treatment. Doctor visits. Prevent eye care medical equipment. You pay a monthly premium for Part B in 2025. The standard Part B premium is $185, but high earners pay more. This is where IRMAA comes in, income-related monthly adjustment amount. If your income is above a certain level, you pay an additional premium. In 2025, IRMAA starts if individual income exceeds $106,000. For couples, this threshold is $212,000. IRMAA is calculated based on your income from 2 years ago. So for 2025 IRMAA, your 2023 income is reviewed. If your income dropped after retirement, you can appeal. You fill out the life-changing event form. Situations like divorce, loss of spouse, job loss are accepted. People in the highest income bracket can pay up to $628 per month for Part B, plus there's IRMAA AA for Part D2. In total, it can exceed $700 per month. This is why tax strategy is so important when doing retirement planning. Part C, or Medicare Advantage plans, are offered by private insurance companies. They replace Part A and Part B. They usually include Part D drug coverage too. Some also cover dental, vision, hearing. Premiums can be low. There are even zero premium plans. But be careful. Medicare Advantage works with HMO or PPO models. meaning you must go to a network doctor's if you travel or winter in another state. This can be problematic. Also, there's an out-of-pocket maximum limit. You can have up to $8,850 in out-of-pocket expenses per year. Part D is drug insurance. It covers your prescription medications offered by private companies. Each plan has its own drug list. It's called a formulary. You should check which one covers your medications. There's also IRMAA for Part D. High-income retirees pay extra. In 2025, the standard Part D premium is approximately $50. With IRMAA, it can go up to $85. Now we come to the most important decision. Medicare Advantage, or Original Medicare plus Original Medicare is Part A and Part B. Coverage is broad. You can go to any doctor that accepts Medicare, but there's copay and co-insurance, meaning you pay a certain percentage for each service. There's no out-of-pocket limit, so costs can be unlimited. That's why there are Medigap plans, also called Medicare supplement plans. These cover the portions Original Medicare doesn't pay. Plan G is the most popular. It covers almost everything except the Part B deductible. Monthly premium ranges from $150 to $200. Which option should you choose? This depends on your personal situation. If you have chronic conditions, if you regularly take medications, if you go to the doctor frequently, Original Medicare plus Medigap might be better. If your health is good, if you don't have many expenses, Medicare Advantage is a low premium option, but remember this. Switching from Medicare Advantage to Medigap can be difficult later. If health problems arise, the insurance company can reject you or demand very high premiums. When you first start Medicare, you have a 6-month guaranteed issue right. During this period, no health questions are asked. So, what doesn't Medicare cover? Here's the big surprise. Long-term care. Medicare only covers short-term skilled nursing, maximum 100 days. After that, it's your responsibility. According to Genworth's 2024 report, nursing home costs are $116,000 per year. Assisted living is $64,000. Home health aid is $33 per hour. Most people need care for 2 to 3 years. This means $200,000 to $300,000 in costs. Long-term care insurance covers this risk. It's recommended to get it in your 50s. When you're younger and healthier, premiums are lower. After age 60, premiums rise significantly. After 70, it's almost impossible to get. As an alternative, there are hybrid plans. Long-term care combined with life insurance, or combined with an annuity. These can be more flexible. If you don't use it, it goes to your beneficiaries as a death benefit. Another option is self-insurance, meaning insuring yourself. By using a health savings account, HSA has tax advantages. Tax deduction when you deposit money. No tax while it grows. No tax when you withdraw for health expenses. After age 65, you can use HSA for anything. You just pay income tax for non-health use. Now, let's give a concrete example. John and Mary are 62 years old. John wants to retire early at 63. Mary will still work. They're making plans together. If John retires early, he needs health insurance. Can he be included in Mary's employer insurance? If possible, this is ideal. If not, he'll apply to the healthcare marketplace. Their income will be low. Because John isn't working, not taking Social Security yet, he'll make minimum withdrawals from his 401k. Maybe $40,000 to $50,000 in annual income. In this case, they can get subsidies. When they reach 65, they'll apply for Medicare, Part A and Part B. John is a chronic diabetic. He goes to the doctor regularly. He has medications, so they choose Original Medicare Plus Plan G. Mary is healthier but prefers the same system alongside John. For Part D, they research the best plan. John has medications like metformin, lisinopril. Which Part D? Plan covers these. There's a plan comparison tool on Medicare.gov. Using this, they find the most suitable plan. Their total costs Part B premium for both is $370. Plan G Medigap for both is $350. Part D for both is $100, $820 per month, $9,840 per year, plus out-of-pocket drug costs. Copays, maybe another $2,000 to $3,000 per year, total of $12,000 to $13,000 in annual healthcare costs. This figure must be in your retirement budget. Many people underestimate this. They only calculate the Medicare premium, but dental, vision, hearing, these aren't in Medicare. They must be calculated separately. Dental treatment is important in retirement. Medicare doesn't cover dental. You can get private dental insurance or use a discount plan. Annual costs is $300 to $500. Glasses and eye exams. Medicare only covers certain eye diseases. Routine exams and glasses aren't covered. Vision insurance or out-of-pocket payment. $200 to $400 per year. Hearing aids are very expensive. $5,000 to $7,000 for both ears. Medicare doesn't cover them. Some Medicare Advantage plans offer partial coverage. Otherwise, you pay yourself. So, how will we finance all this? This is where financial tips for 50+ come into play. First, include your healthcare costs in your retirement calculations. Fidelity says $315,000. Calculate based on your own situation. If you have chronic illness, more. If you're healthy, a bit less, but never zero. Second, develop a tax strategy. Plan your 401k versus IRA withdrawals so you don't hit IRMAA. Do Roth conversions early. Withdrawals from Roth IRA don't count as taxable income. They don't go into IRMAA calculation. Third, use HSA. If you're using a high-deductible health plan, make maximum contributions to HSA. Save this money for retirement. You can use it for Medicare premiums, for Medigap premiums, for prescription drugs, for dental treatment. All tax-free. Fourth, make a long-term care plan. Will you get insurance, or will you cover it yourself? Decide. 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 Early. Your 50s are the most appropriate time. Fifth, make your Medicare choices carefully. Don't rush. Research. Use the Plan Finder tool on Medicare.gov. Which plans do your doctors accept? Which Part D covers your medications? Ask these questions. Sixth, do an annual review. Medicare Advantage and Part D. Plans change every year. Coverage changes. Premiums change. October through December each year is open enrollment period. Review your plan during this period. Change it if necessary. Seventh, watch out for Medicare fraud. Unfortunately, it's very common. No one asks for your Medicare number over the phone. No one offers free equipment in suspicious situations. Call Medicare 1-800 Medicare number. Eighth, keep your records. Medicare summary notice comes every 3 quarters. Check it. Was a service you didn't receive billed? Is there an error? Appeal. Finally, invest in your health. Preventive care is important. Medicare covers annual wellness visits, free mammograms, colonoscopies, vaccinations are free. Don't skip these. Early diagnosis is always cheaper, more effective. Healthy lifestyle is the best insurance. Exercise, eat balanced, avoid stress, pay attention to your sleep pattern. These significantly reduce your healthcare costs. Remember, retirement planning isn't just depositing money in your 401k. Planning healthcare costs is just as important, maybe more important, because healthcare costs can destroy your retirement. If you can't control them, they can eat up all your savings. Medicare is a complex system, but it can be learned. Take the time, research. Make the right decisions. Get professional help if necessary. There are Medicare advisors. There's a free SHIP program. State Health Insurance Assistance Program, available in every state. They help you. One last tip: your Medicare start is independent from your Social Security start. You can take Medicare at 65, but postpone Social Security to 70. This is a very smart strategy. Social Security grows 8% each year until 70. You must start Medicare at 65. Otherwise, you pay a penalty. But you can postpone Social Security. To summarize, plan your health insurance for ages 50 to 65 COBRA or Marketplace. Adjust your income strategy accordingly. Apply for Medicare at 65. Do it on time. Part A, Part B, Part D. Decide Medicare Advantage or Original Medicare. Make a long-term care plan. Use HSA due tax optimization. Review annually. If you follow these steps correctly, your healthcare costs will be under control. Your retirement will be peaceful. Your savings will remain for you and your family. This is very important, folks. That's it. Now sit down today. Get paper and pencil or open Excel. Calculate your healthcare costs. Make your long-term care decision. See you in the next video. Healthy and wealthy days.